Good morning, everyone. Thanks so much for joining us for Shine's Parenting Through Cancer session. And we're doing this with Jen and Nicola from the Little C Club, which we're really excited. This is the first event we've done together, so we're really excited to work with them and to kind of get to know them. So what we're going to do today, I'll do a little bit of an introduction. They're going to talk a little bit about their stories and where they've come from, and then they'll talk a bit about the cards that they've developed for sort of facilitating discussions with children. And then we'll probably have time for a Q&A, and we'll try and finish up about 5 to 11 because it is Remembrance Sunday, which I hadn't clocked when we booked the conference, but that way that'll give everyone time to kind of get away and observe the silence if they'd like to. So I'm Kynwan, I'm one of Shine's directors, and this is really kind of an important topic for me because I was diagnosed with non-Hodgkin's lymphoma when my daughter was 6 weeks old. So obviously at that time, she didn't know what was going on, but as she's grown up, she's kind of had to live with, all of the appointments and the side effects. I'm in remission, but I have an immune deficiency. So I've always kind of been going to hospital appointments and that kind of thing. And she's 11 now, but what's been interesting, I guess, is as she's grown up, the questions that she's asked and her awareness has changed. And it's sometimes been tricky to know what to say. But luckily we have 2 experts with us today. So we have Nicola, who is a nurse, and Nicola was diagnosed with breast cancer at 26, and then re-diagnosed with secondary breast cancer about 10 years later, just after she gave birth to one of her children. And then we've got Jennifer, who is you a head teacher, assistant head teacher?
Oh God, I'm an assistant head teacher.
Assistant head teacher. Yeah. She's also lost her voice in a non-COVID non-COVID way. So we're even more grateful to her for joining us because she sounds a little raspy, but she's going to push through. So they're going to tell us a little bit about the Little C Club and their work. So I will hand over to you guys. Thanks so much for joining.
Morning, everyone. So I think I'm going to go first with my story. Jen, do you want to put the slides up now, or should we do that?
I'll do it after.
Okay, so I'm Nicola. Thanks for introducing us, Kynwan. So I was diagnosed with primary breast cancer when I was 26, and I underwent chemotherapy, radiotherapy, and then on a hormonal preventative tamoxifen. And I decided to take a break in that tamoxifen a few years in, and I had my first child, Dylan, who is now 6, and was fine, didn't have any problems at all. And then I went on to have another break and have my second child, Poppy. But when she was 4 months old, I was diagnosed with secondary breast cancer, which had spread to my liver and my bones. And I was put onto palbociclib, which is a targeted therapy, and I also have denosumab, letrozole, and Zoladex to keep my hormones under control and stop them from producing. And thankfully, touch wood, that has kept me stable for the last 3 and a bit years. It's been a strange journey. So when I was first diagnosed, I didn't have any children. It was just me and my husband. Well, then we were engaged, we weren't even married. But bringing the children into it for the secondary diagnosis was quite a different experience, and that was my biggest concern at diagnosis. And my Poppy was so young, she wouldn't have understood anything anyway, but I was so concerned about how it would affect them and how I was going to talk to them eventually. So it was really important for me to try and find a way that we could just have normal conversations and not make it such a big deal, and just bring it into our lives, because obviously it's not going anywhere for me now. It's something we're going to have to live with, and it will eventually progress, and I want them to be knowledgeable and have some kind of preparation for how that will look. So that's my story.
So I'm Jen. My story is slightly different in that I found a lump in my left breast in February 2019. My mum has had breast cancer twice, so she had a mastectomy and then she had radiotherapy the second time, so she's all in the clear now. So I kind of went to my mum and I was like, oh, I found this lump, I don't really know what it is. I went to my GP, got given the normal, you're very young, are you on your period? There could be a host of reasons. And I think I was quite bolshy in pushing because of my mum. So she sent me to the breast clinic, and I would imagine anyone who's in this call will have probably been through a similar process, that you go to the breast clinic and you get placed in one room, and then you get moved to another room, and then you go and have an ultrasound and so on. The mammogram actually didn't show anything. So if I just had a mammogram, because my breast tissue is so dense, because of being quite young, they said they wouldn't have seen it. So then they did an ultrasound and found that I actually had a lump in the top of my breast, and also a smaller one slightly behind, which you couldn't feel. Sorry, excuse me. So yeah, went and got introduced to my new friend, my oncologist, who said that obviously that we're going to treat it. The decision was made to have chemo before surgery, which always confused me a little bit, because I suppose psychologically in my head I just wanted it gone, but their logic was to shrink it enough that they got really good margins to be able to potentially only do a lumpectomy at the time. So I had 4 sessions of paclitaxel, and then 4 sessions of EC, or the Red Devil, as some people call it. I didn't actually find that one too bad. I lost all my hair. That was quite traumatic. I think in the oncology appointment, the first things that came into my head was my children. I've got 2, and my hair, very vainly. That is a big part of you, isn't it? So to suddenly not have it, you kind of lose your identity, and it's not very pleasant. So I had all of the treatment. Everything showed that things had shrunk and that it was really positive. And I was then set to have a diet mastectomy in, I'm trying to think back, like May, June time. And I had to go for an abdominal, I can never say it, CT scan, because of the fact that they were going to use some of my stomach muscles to reconstruct. And that's when they found that there was a spot on my pelvic bone. I do sometimes wonder if I'd had a different surgery, whether or not I would have then not found out about my secondaries until a lot later, because I didn't have any symptoms of secondary breast cancer. I ran a completely normal life, very active. I say active, I don't do sport, but I run around schools after children who aren't in classrooms, so you have to be quite motivated. And yeah, they were like, oh, so we're not going to do the surgery now. And I was like, what do you mean you're not going to do the surgery now? And they were like, they explained, and I'd never heard of secondary breast cancer before, didn't know what it was, obviously very much more educated now. But yeah, so I've had a number of different treatments, but I am on something called eribulin, which is an IV chemo that I have on a 3-week cycle. So I have 2 weeks on and 1 week off, where I am perfectly functioning, apart from a really bad throat. So yeah, that's kind of my treatment kind of package. I suppose it's probably a good idea to explain where Nick and I met. Should we go to the slides? So I'm just going to show you this on the screen and hope that it works. Oh, let's go back. So obviously, you know, Nicola is a nurse and I'm an assistant head teacher. We actually met in Bristol just before lockdown, where we attended a Breast Cancer Now secondaries patient kind of residential retreats. It wasn't a spa, it was a very nice hotel, wasn't it, Nick?
It was.
Yeah, we actually met at the bar with a glass of wine, and we actually don't live very far from each other. So the irony is that we'd gone all the way to Bristol. I don't know if anyone knows Bluewater or Lakeside, the shopping centres, but we basically live on the opposite sides of those places. So we're about 40 minutes apart, which is hugely ironic. But Nick and I really kind of clicked. I think our children, so I've got Eliza who's 10 now, and Albie who's 6, the same as Dylan. And I think we just had a really similar approach to talking to the kids and kind of giving them enough information that they understood, but not scaring the bejesus out of them. I mean, in my primary diagnosis, we read a book, and the kids actually liked the book. It was about mummy being a superhero, and I felt like I'd got one over on my husband because that's now I'm a superhero. I'm invincible. And Eliza asked probably more questions than Albie. Albie was very literal. He once told me that I had less hair than Grandad Keith, which was a highlight of my treatment when my 5-year-old's comparing me against my 70-year-old dad and our hair status. But he did it because that's what he saw, and it was quite funny. Another time, we're quite open in our house, having showers and whatnot. And Albie was like, "Oh, where's your boob gone? Why has someone stolen your boob?" And I was like, "Oh no, nobody stole it." I said, "The doctor took it away because it had bad bits in it." And he just totally accepted that. And I think if I probably asked him now, that's probably how he would explain it again, quite flippantly.
I haven't, no.
So the session, the residential itself was brilliant. So if they are starting up again, if you had the opportunity to go, they are amazing. And Nick and I are still in contact with all of the people that we met there. There was probably about, how many people went, do you think?
It must have been about 50 or 60 maybe.
Yeah, I
think the thing that was good about it was specifically for younger women. So there were a lot of local support groups that we've been to and experienced, but they tend to be a mixture of people that are a lot older and at very different stages of their life, whereas this was people that were all on the same page, and lots of them had younger children, and we all had the same kind of concerns and worries. So it made it a lot better to bond with people and make those friendships.
Yeah. And so there was a series of workshops and sort of lectures during the days. So it was over 2 days, where there was oncologists who came in and talked to us about all of the language, because it's such a minefield, all of the HER2 positive, estrogen negative. I mean, I still don't really have my head around it. And then other oncologists who came in and talked about trials and the different stages of trials, which was fascinating and really interesting. And I think we both came away a lot more informed than when we went. And so we kept in contact because we liked each other. And then lockdown happened. So Nicola and I, like the rest of the world, carried on talking on Zoom and WhatsApp. And Nicola was in the process of making a book to talk to children about having cancer, specifically secondary breast cancer. But one of the sessions that we went to, the woman, she had some really brilliant ideas, and we still use some of the things that she suggested. But at the end of the session, in a very highly emotive room, she read out a book that literally floored, I think, most people that were sitting there to tears, which I don't think was her intention, but it probably wasn't pitched quite right. And so when we came away, we was like, surely there must be a different way, or a way that we would feel more comfortable in sharing information when we needed to with our children. So we kind of started doing some research around the importance of talking to children and making sure that we're giving them enough that they don't start formulating their own outcomes or opinions. Or in my case, I think my biggest fear was Eliza was obviously getting older, she was using the computer more. What if she started Googling in my diagnosis, for example? And the information online, we all know, is very outdated, and the statistics aren't correct. So I wanted to be able to kind of navigate that so that we were in control. And so we were giving them enough information. So we spoke to Maggie's, we looked at mental health and how we could kind of incorporate that within our flashcards. And then we kind of came up with this concept that when Albie and Dylan were learning their phonics and their letters at school, they would use flashcards. So they were really used to that process of learning and understanding that kind of format. So Nick and I created a set of flashcards, so an alphabet of A Little Human's Guide to Cancer. Nick, do you want to talk about the cards?
Yeah, so Jen used her skills as a design teacher to do all of the illustrations you see on the cards, and then I looked into writing what was going to go into the cards, and it was important to us that they were very factual but not overwhelming. So the information on the cards is very concise and broad. So another thing that we felt was a lot of families have very different situations. There are different types of cancer, different stages. You could never write something that was going to fit all of those situations. So the idea of the cards is that they have this small piece of information just to start a conversation, and then they can be tailored to fit any kind of situation, because we felt that the biggest thing for both of us was having the confidence just to start those conversations. And where do you start? I mean, for me, my children have never visibly seen anything different, because I had my primary, when I had my chemotherapy and lost all of my hair, was before them. So they never saw any of those really visual indications of cancer. Since I've had it with them, I've kept my hair, I've been fairly normal. So it was just about where do I start? How do I start speaking to them about this without making them frightened, but also, like I said before, trying to make it a normal part of our daily life. And if there's something they hear somewhere that frightens them, I want them to be able to come and say, what does this mean? Can you explain it? Or if they hear mummy and daddy talking in the kitchen about an appointment or something like that, I want them to have that knowledge to know that it's not something that they need to be scared of. And the cards do that perfectly, because they focus on specific aspects of treatment, so operations, appointments, chemotherapy, all those kind of words that you would mention to adults around while you're having treatment that you may not even notice your child's picked up on. They probably have, and they're big scary words that they don't understand. So it's just about addressing those and making them normal. So that was the aim with the writing. And then we just wanted to keep them really bright and colourful and non-offensive, just to make them friendly and relatable to a child. So we've also added in an activity or talking point on every card. So there's also, if the information does get a bit overwhelming and a bit heavy, then there's a fun activity to try and just consolidate that information and just make it a bit lighthearted and have a bit of fun as well at the same time.
So we designed the cards, we printed the cards, we've been really lucky. The cancer community have really kind of taken it on board and seem to really like them. And now we've kind of been working on some developments off of the back of the cards as to what we do now. So now we've got kits that we've created with whiteboards in so that they can draw, so it's a bit more like art therapy. There's a badge, there's a journal, which we've kind of encouraged it to be parent and children, that kind of doing those things together. But yeah, it's been really successful, and I think it's given Nicola and I a bit of a focus as to having something really positive to look forward to, and kind of using our skill set to help people. And we get a lot of questions on our Instagram page about talking to children, and there is no right or wrong way of doing that. there's no way we would ever suggest that you sat and read through the A to Z of cancer, because I think that would become quite depressing in itself. But the idea is that the cards themselves are really, really exciting and interactive, and just explain it in a really safe and comfortable way, I suppose. So I'm just going to come out of this. Stop sharing that. Okay. Yeah, I don't know if anyone's got any questions that they wanted to ask, or yeah.
No, that's great. Thank you, guys. I mean, I think it's really important, actually, because like you said, you know, kids have different types of questions, and as they get older, they get exposed to, you know, different friends with different ideas even. So I can remember my daughter coming home once and saying, oh, someone in her class said that if you get cancer, you die. Yeah. And she was really upset. And you know, I said, well, obviously,
why don't you make a start,
and I
and
haven't
then I'll
died.
come and join you with a room.
Someone off the... Oh, there we are. I'll mute them. So yeah, I mean, I kind of said to her, look, obviously, you know, mommy had cancer and I haven't died. And then, I mean, because of the line of work I'm in, I was able to kind of point to half a dozen people that she knew who had cancer, who were still alive. So I think that helped, but obviously not everyone has that. Not everyone works for a cancer charity. So I think these things are really useful, because I think that quote that you put up, I think from Maggie's earlier about, you know, if you don't talk to kids, they kind of fill in the gaps themselves, don't they? And sometimes actually what they fill in can be even worse than the reality.
Yeah, definitely.
Yeah.
Alice has asked, are the cards focused on any specific cancers? No, we were really keen to make it as generic as possible. So we obviously both have breast cancer, but we wanted to make sure that they were inclusive to everybody. So there's no reference to any kind of specific cancer. In terms of where you can access them, so we have a website called thelittlesclub.com, where you can purchase the cards. The kits are also on there as well, and you can also message us on our Instagram page, which is at Little C Club. So
what ages are they for?
Yeah, so we designed them 2 to 10, because that was our kind of remit that we had with our children. So Nicola with Poppy would use them to identify colours or letters, so that they became part of a game at home. Albie writes out letters with them. He's now reading, so he can read the backs of them. He really likes doing the activities at the bottom, because they're all really, there's a lot of like games, and like, for example, on the body one, how many different body parts can you name? Where are they in your body? So you start getting them to identify what's normal for them. And I think that's a big thing within the cancer community. Everybody talks about advocating for your own body and knowing what your body is and what's right or wrong, and things like that. So that's been really good for him. And then they've been doing science at school, and Eliza's been learning about different bones. We've then kind of dropped in, oh, mummy's pelvic bone, that's where her spots are, aren't they? Or the naughty cells, as we talk about them in the flashcards. And she's like, oh yeah. So it's kind of trickled in, but not forced on them. It's not like we sit at every dinner table and I have to get in the C card.
They're quite good to use in just everyday life as well, like with Poppy. I mean, I literally just use them for the alphabet and starting to recognise some of the words with Poppy. I don't really talk about cancer with her. She's too young. She's just about to turn 4. But we just use them for the words. And there's a card about injections. So when she had a preschool booster jab, so I used the injection card to tell her what we were going to do at the doctor's and explain it all and give her a bit of information. So they just fit really nicely into everyday life. There's a big focus on well-being and kindness and self-care as well, so it doesn't all have to be about cancer. You can use them for other things as well.
Yeah, I think that's really important, isn't it? Sorry, Jen, you were going to answer another question, I think.
No, it's fair. Louise, the residential was Breast Cancer Now. So on their website, they have a whole range of different events and residentials. And I'm pretty sure Catherine, who's one of the nurses who runs them, said that the secondary ones would be starting back up again, which is great. You should go.
And I should say also, if you don't have breast cancer, so Shine, obviously we support anyone with any type of cancer as long as they're in our age group, and we run residentials as well. You know, pre-pandemic we ran residentials. We're hoping maybe the latter part of next year to get back to some of those, but we also have a couple of online programs. So we've got the Breakout Program, which is a 6-week online program. It's 2 hours a week. And that's a small group. It gives you a chance to discuss lots of issues. And that's for anyone who's kind of, you might be in treatment, you might have recently finished treatment, you might be a few years out of treatment, just kind of processing stuff. But we've got another program called Shine Circles, and that's for anyone living with, we've just said an incurable diagnosis. So that, because that covers a huge range of things. It might be that you've got a kind of chronic blood cancer. It might be that you've got secondary breast cancer. It might be that you've got, you know, bowel cancer, which is more advanced. So that's open to anyone as well. And we'll be running those programs again. We're just finishing up for this year next month, but we'll have more in December as well. Oh, sorry, January. So there's quite a few sort of options.
I think that's a really important thing as well. I mean, regardless of the flashcards, me and Jen have made a friendship that we support each other, and not everybody gets it unless you're living it. It's quite hard to explain to other people sometimes how you're feeling and what you're going through, but because we're in similar situations, we get each other, and it's been a great source of support. So I think if you've got an opportunity to meet some people in a similar situation and make those bonds, it's really, really important.
And are your children friends? Do they kind of know each other? Because I think that can be really important as well, for kids to be around other children whose parents are going through something similar. I don't know how aware they are of that, but they might be.
I don't know that they know. I think Eliza knows, because when I talk about Nicola, I'm like, oh, Nicola, like mummy. And so I think she understands that, but she would never question it, and she would never look at Nick and think, oh gosh, she's got cancer like my mummy. And sometimes I find myself not reminding Albie, but like, if I think, who is it, Daisy was talking about obviously being a little bit worried about how she's going to feel after chemo, about being tired and things. And I actively plan things now where it's just going to be quiet and it's just going to be chilled. The kids love a movie night, which I tend to start about 4 o'clock, because I am that mother who wants them in bed by 6. No. They're asleep by 6, but I'd love them to be upstairs by 6. But yeah, like movie nights or board games. My kids love a board game, and even if I'm not really doing it, as long as I feel like I'm involved, it's quite nice. Nick got out the Christmas pajamas yesterday.
Yes, I've had a bit of a rough week just in general, and I just thought we need something a bit feel good, so we got out our matching Christmas pajamas and all slumped in front of the telly and watched a Christmas film. A little bit early for some people, I know, I'm sorry, but it was lovely, and the kids love it. They don't really know any different. It was a nice activity for them, but for me it gave me a chance to be doing something with them, but also just rest and recuperate a little bit.
Yeah, definitely. Someone's just said, what about if kids are struggling? Info for kids is a great step. Do you know of anyone who does signposting for kids who need more support? You know, being told, oh, art therapy might not be helpful.
No, so we were fortunate enough when we launched our cards that we went to a Maggie Centre, and I think they're kind of dotted all around, but they have specific sessions where they work with children who have a parent who is going through a cancer diagnosis, and they do a series of different activities with them, either one-to-one or as a family, or as a larger group. I know the larger group sessions, friends of mine have been to those with their children, and they've really enjoyed it because they're able to talk to the other children who are there about their experience and feel that there's some sense of normality. Art therapy is very broad. our cards aren't specific for art therapy. There are qualified children's psychologists who deliver those kinds of sessions. But that's something that I will put my children forward for, as and when I feel that things are progressing in a certain way, so that they can get the support that they need, because there may be times when they can't talk to me or my husband about what they're thinking, but they might feel more comfortable, because they don't want to upset us, to talk to somebody external. And the child psychologist that we met there was absolutely amazing. She had total control of the activity and what the children were doing, and it was just the way that she was feeding really positive kind of conversation within it, but with a purpose, and every session would have a different purpose, and they would tailor that to your specific child.
I think when you think about art therapy, it might not sound like it's going to help, but what she explained to us was the mind goes through very different processes when you're being creative, and actually it helps you to open up and talk about those things that you're feeling. So it might be worth a try. She was so good, the lady we met at Maggie's, and actually made us feel like it could be quite helpful. So it's worth a try. Like Jen said, just having that external person that they can speak to and not feel like they're going to upset or cause any more worry can just be all that they need.
There's also there's a couple of other organizations that we work with sometimes, so depending on kind of how old your child is, if you were diagnosed and your child is still under one, Mummy Star has some support if you're available. And then these aren't kind of signposting specifically for kids, but the Willow Foundation, and something to look forward to, also can provide treats for families going through a difficult time. And actually, that can just take a lot of pressure off, right? Tickets to a show in London or something, and where you just actually can have a nice time and kind of not worry about the money, not worry about things, but you get something special out of it. A cancer perk. If you've got to go through this,
There's also a charity called the Chris Akid Foundation that me and Jen have both used, and they provide special days, but they also arrange counselling for young children as well if it's needed. So they'd be a good one to look at as well. They're really good.
The other thing, which some people have told us about, and Jen, I don't know, you're an assistant head teacher, but certainly some of the schools around me have actually brought in more psychosocial help for the kids as a result of the pandemic. And so if you talk to your children's school about what's going on, they might be able to get them a session or two with one of the school counselors, which, can just give them another outlet, can't it?
Yeah. No, definitely. There's definitely been an increase in the amount of funding that's gone into schools now for external counsellors to come in. We're quite lucky. Both our children's schools obviously know about our situation and are very mindful of sort of monitoring them. And I think as hard as it was to have that conversation with the school to kind of say, look, this is the position that we're in, and it's very unknown. It was I found it reassuring to know that they knew. I purposely asked for it only to be the class teacher and then the head teacher, who we happen to know, to have that information, because I know what schools are like. I didn't want my children labelled as those mums who've got cancer kind of card, and having a little chat about how sad it is in the staff room, because my children don't come across like that. They are very normal, but it was good to know that the school would pick up on anything if there was ever to be an issue, or somebody was upset or was asking questions that maybe they thought were related to it, but that they didn't know how to answer. So yeah, definitely.
Another organization, which I know you guys are aware of, is called the Fruit Fly Collective. And they've got kits slightly different than these ones, but also aimed at different ages. So I think they go a little bit older.
I think they do some teenager ones, which is really good.
Yeah, I think they go from like 3 to 14 or something like that. They've got quite a broad age range in different types of kits, and there's also a specific kit for people with incurable cancer as well. I think it's called PIP's kit. that looks at slightly different aspects of what's going on. So yeah, they're a really good resource.
Yeah, and
Alice.
Caroline, who started that, her father died when she was young, so it kind of also came out of, you know, a personal experience, which I think is useful.
Yeah, Claire said that they're really good for older kids. They've got resources on their website yet.
Yeah.
Alice, what we'll do is any of the ones that we'll talk about, we'll make sure that Shine, then you guys will signpost everything afterwards, won't you? Another really good charity who, or two actually, that Nicola and I have both worked with, Make Seconds Count, which support women with secondary breast cancer, and also their families, but also the WOLO Foundation. They also do trips out and days and experiences. They sent us treats and all kinds of stuff at Christmas last year. They're just people doing good things, and that was all set up off of the back of losing somebody to cancer. So they've got a real insight into what people actually need.
I think one thing that's interesting, that's come up before when we've been talking about this also, is the sort of pressure, you know, to kind of make memories, right? Like people go, oh, you got to make, everything's got to be making a memory. But actually, when I've spoken to psychologists or people who work with children, actually what they tend to say is, you know, it's as much as you can to be open with your kids so that they understand for their age what's going on, so they don't fill in the gaps and get scared or have worries that they're not sharing with you. But also, you know, kids generally just want you around. So, you know, if you can give a little bit of time to them, like Nicola did, get out the Christmas pajamas and lie in bed and watch a movie, actually, they're really happy just to have you there. It doesn't need to be trips to Disneyland, which I think sometimes is, you know, that's what you see on TV, right? You see these kind of amazing people who are dying of cancer and they're going to Disneyland and running a marathon, and actually life isn't like that. And, you know, that sometimes all of that pressure can actually take you mentally away from just being present for your children. And actually probably the biggest gift we can give any of our kids is just being with them, because they're usually just happy to spend time with you no matter what it is.
Yeah, no, definitely.
Really?
I think when you first get diagnosed, there is that I have to do everything and I have to be everywhere and I have to be the best at doing this, and it's exhausting. And then to have treatment on top. I know since I've started this new chemo treatment, part of I can't remember who was talking about it. I think it was Daisy. Part of the thing that I found is that you get yourself into quite a routine and like a cycle. So, you know, on a Friday, so if I have my treatment on Friday, Saturday, I'm fine, so I can do things. Sunday, Monday, I need to be in bed or I need to just not participate. And then for the rest of the week, we're getting good again. So I think if you have in your head that 2 out of the 7, you're kind of benched a little bit, that there's absolutely nothing wrong with that, and ultimately, like you were saying, the kids will just come to you. Mine will quite happily come and sit in bed and do not a lot, and be quite content with that, rather than asking 24/7 what we're doing next, which sometimes happens. But yeah. We lost you.
My internet just went down.
Panic. What would we do?
I was like, all of a sudden everything was technical and it kicked me out of the meeting. So, okay, we're still here. Whew, that's good news.
Daisy's, but I'm worried about missing Christmas. Don't worry, you won't miss Christmas. It will. I think you just make Christmas what you want it to be. Part of me really enjoyed last Christmas because I didn't have everybody else at my house, and really selfishly, it was just the 4 of us, and it was amazing. And now this year we've got like loads of people coming, and I'm like, oh, like it was horrible for the grandparents last year not to see the children, apart from at a park bench. But yeah.
Yeah, and Claire, I mean, you said the other gap in support is for kids whose life is constrained because of chemo, you know, is suppressing their mum in COVID. And I completely understand that. And I think it's a really tricky situation because you worry. I think it's one thing for yourself to miss out as an adult, but to see your kids missing out on things is really tricky. And I think there is no easy answer because everyone needs to find their own way through it. But one thing, so I have an immune deficiency as a result of my cancer treatment. So, I'm high risk and it's been really tricky. And I think the only way that I've found through it really is trying to arrange stuff with their friends outdoors. And, just obviously if you got access to the lateral flows, making sure everyone does lateral flows. And, my daughter's birthday's coming up and we've found a forest laser tag place. So, and we run around the forest in December, which obviously is not the same as a cozy movie, but, if you can find things outside or invite people to come to the garden, just so that they, get some interaction, as much as you feel comfortable with, that can help a bit. Also, the other thing I've learned, and I don't know what Nicola and Jen think, but like, we're aware of what people are missing out on or how things are different, but actually they're not in the same way. They haven't had 20, 30, 40 years of living a life pre-COVID. So, it can be really hard if they see their friends doing other things that they can't do, but they don't bring the same kind of baggage to it as we have. I think we feel a lot more guilty sometimes than the kids do. I don't know what you guys think. I think this COVID thing is just really tough for everyone.
Yeah, it's hard, isn't it? I mean, I think you're right what you said before, just being present and spending time with them is so important. But my kids are younger, so they don't have that understanding. I imagine if you've got an older child that is watching their friends go out and do things, it must be quite difficult. But mine would be quite happy to stay in and play games, and as long as I'm participating and being part of that, I guess that's what's important to them. But yeah, it's a difficult one, isn't it? I don't know when COVID just needs to go away now, doesn't it? I think everyone's just over it. We just need to get back to some kind of normal life.
I think that's really hard as well, because you kind of see some people behaving as though, we're not in a pandemic. And, like Claire said, it's brutal. They get sent home from school whenever there's an outbreak. They can't attend birthday parties, and they definitely know, it's really hard. And I think, the other thing is maybe to speak to your doctor, if you can, about, I've done this about, what would happen if I got COVID? What's changed? Because actually, treatments have improved, therapeutics have improved, the vaccines have helped a lot. And obviously you want to avoid COVID as much as you can, but there is also a balance of protecting your own mental health and the mental health of your kids. And certainly, at the beginning of the pandemic for me, people were like, well, if you get COVID, you'll die. And now they're much more like, okay, if you get COVID, there are things we can do. There are new drugs coming out. There's a new antiviral that they're getting in the UK this month, hopefully. So, things are changing, and hopefully by the middle of next year, things will be a lot better.
I think generally medical staff have learned how to take care of these patients better as well. I think when it first happened, no one really had a clue what was going on and how to make it better, but they've learned so much over the course of the pandemic, and now are much more prepared to look after people coming in with COVID, and the outcomes are a lot better than they were at the start. But there's still so much fear surrounding it. So I totally see where you're coming from, and it's a really hard decision to make, isn't it? But like you say, there's a balance between protecting your mental health and the mental health of your children, and also your physical health. It's a difficult call.
And also, I think if you feel comfortable, and I found this really difficult, I don't know how you guys feel, but like actually being open with people and saying, you know what, we would really like to come, but we can only come if everyone's vaccinated and does a lateral flow test. And actually a lot of people are really happy about that, because it gives them an excuse to say to everyone, can you do a lateral flow test before you come? So, seeing, your 5-year-old wants to go to a party, that can be really tricky if you don't know who's going to be there, but maybe talking to the mum if you can, or the parents, or inviting a couple of friends over to play outside, or to do lateral flows beforehand and go into the bedroom with the window open, that kind of stuff, which just lowers the risk a bit. It's obviously none of that is risk-free, but I think certainly I've heard from different doctors and nurses that they appreciate none of us live in isolation, and what we would do for ourselves we can't necessarily do for our kids.
I think it's a tricky one, because obviously it's everybody's own personal view, and everybody's got different treatments. My children still go to clubs and they still go to parties, because I just think that that's best for them. It was a conscious decision that Rich and I made. They went to school, they went back. If there's cases in the class, then obviously we get told. Albie was supposed to go to a party on Friday, and the dad and the brother tested positive for COVID, so they cancelled it. And I just think people are taking it seriously and trying to be as cautious as possible. But yeah, I think
if you can be open with your diagnosis and letting people know, which is tricky, because you've got to then tell people maybe you don't want to tell, but nobody wants to give the cancer patient COVID. So
no.
Sorry, Nick, you were going to say something.
I was just going to say, I think if the children are going to school, there is already some risk there, isn't there? So I think my children have still gone to parties and whatnot. Maybe I just find someone else to take them rather than me go with them. There's going to be an element of risk everywhere, isn't there? And I think it's just about finding the safest way to take that risk.
And Carol has just said, I've got a 10 and 11-year-old. My 10-year-old son's very close, doesn't want to talk. Any tips on helping him open up?
It's tricky, isn't it? Because if he seems happy, you don't want to force an issue that's not there. I think it's just about reminding him that everybody's there to be able to answer any questions as and when he has them, because there will come a point where he'll have questions, and you might find that your daughter's feeding him the answers that he needs without you even knowing. 10-year-old boys, I'm not sure they're real big talkers anyway, so it's kind of strained, isn't it? Like you don't want to have to keep talking about cancer or any kind of incurable issue. But I don't know. I
think the most important thing is to make sure that he knows you're there and open to being asked questions. So I would just make sure you're regularly asking him if he's okay, if he's got any worries.
And also, if he's kind of 10, 11 years old, obviously he can probably read on his own. Getting something like these cards or the Cancer Cloud kits from Fruit Fly, and just having them around so that he can look at them in his own time, because those are sort of age appropriate materials. That might be useful, because he might just want to read something on his own and think about it, rather than sitting down and having a big talk. So you could get some of those things and just leave them around the house where he could take a look at them in his own time.
I think because she said that they've done exactly that, and that it's on his shelf when he wants it. And I think that's perfect, isn't it? It's there, there's a resource, there's answers to your questions if you want them, and then if you want to have any further conversation, then we can obviously have that.
I just wanted to go back also to so Daisy, I can see you said I had to miss my daughter's 6th birthday party because you were isolating because of your this is why I'm so worried about missing Christmas. Totally get that. And obviously, when we've got to take PCR tests and go into the hospital and miss things, that's awful. The one thing I would say though is that as patients, and it can be really difficult, we often need to push to make sure that our care matches our life. And people, they will give you a letter or send you a text or tell you have to go to an appointment. But actually, if it comes up next time this happens, and you know it's going to be that you have to isolate on Christmas, you are well within your rights to go back and say, you know what, I actually don't want to be isolating on Christmas, so can we push the operation or the radiotherapy or the chemotherapy by a week? Because often a week's delay or a few days delay won't make a difference to the outcome, but it will make a huge difference to actually how you're feeling about living with cancer. So just try to keep that in mind as well. I mean, I think we get so used to being told what to do. Actually, sometimes we need to push back a little bit and say, you know what, this isn't really working for me. I need to change it.
Yeah, no, exactly. Emily's, my partner had bowel cancer 3 years ago, lung surgery this year after everything looking clear. Openly discussed this with our 3-year-old at the time. Advice on how to cope with the lasting damage this has left on the children. I think, well, part of the cards that we have are about feelings and about talking. And there's lots of prompts on the cards with different suggestions about how to open up a narrative of a discussion or a conversation. And one of the things the child psychologist did when we went to the Maggie Centre was have the children draw out emojis and talk about what each of those emojis was and when they felt like that and whether or not they could pinpoint it to a certain time or place. And that was really good. And Albie still makes them. He's still randomly cutting out these circles and doing different faces. And I think sometimes the simpler things are better than overcomplicating it with loads and loads of discussions about what happened in the past. I think it's about how are they feeling right now? Is there anything that's worrying them? We have worry jars. So we have a positive jar and a worry jar. Eliza probably doesn't use them as much because I think she's just a bit more vocal, but Albie, I'll see him occasionally go and drop something in and then I'll just check it out afterwards. And it's normally something really uncancer related. But it's quite nice that he knows that he can go and put something somewhere and that someone will read it and if needs be do something about it. And they do that at schools, so it wouldn't be an unfamiliar thing. And we all made them together, which was quite nice. Yeah.
I think
you can buy worry monsters, can't you? Have you seen those? That is, yeah, fluffy worry monsters online with zips, and they can put the worry in the mouth.
Yeah. I think it also depends on like the level of damage or scars that you're seeing from your child. I mean, if it's something a bit more serious, then I'd go back to what we were saying about them having psychosocial help in schools now, and maybe talk to the school, presuming the child's a bit older now. It says they were 3 years old at the time, but if they're at school, oh, she's 6. Okay, so if you feel like she needs some external support, I would perhaps talk to her school and see if they can offer some help there as well.
The other thing to know is that, because my daughter she's a really good talker actually, and sometimes when she's been behaving a certain way, I've said, oh, you know, is this because you're worried about me or, you know, cancer or whatever, and she'll go, no.
Yeah.
And it's really hard to unpick actually, you know, why children are behaving a certain way, and sometimes they're just having a bad day or they're difficult or they're anxious, and they might be that way anyway, regardless of the fact that you've had cancer or ill, but that's really difficult to know. So, but I think also to remember that kids are complicated on a good day, and then we throw this in the mix, it's harder, but not every behavior that they have will be about this, because they can also be quite self-centered sometimes, children.
And it consumes us, doesn't it? I'm like all encompassed, like this is all about me, so you must be feeling this way because I'm this way. And then they're like, no.
Yeah, absolutely. Well, listen, guys, we've got 5 minutes left, which I think we'll finish up early because, like we said, we wanted to make sure that everyone can observe the silence at 11 o'clock. But I really hope you found this useful. And a huge thanks, Nicola and Jen, for coming along today, because I think it's been really useful and just helpful to have a chance to discuss worries. Everyone else who's joined us, thank you so much for joining us. There will be an opportunity to give some feedback on the session. So if you want me to email resources, please fill out the feedback form and put your email address in it, and we can make a note. We'll drop you all a list of resources afterwards. And then also to say, you know, we've got other sessions as part of Shine Connect that might be useful to you. So we've got a managing anxiety session later today. We've got a clinical trials session later in the week. We have if you are a +1, so if you were the partner of someone who's had cancer, we have a special +1 session this week as well. So check out all of the sessions that we have. And obviously any other Shine programs or the Breast Cancer Now programs also can be great. So, sorry, someone's just asked, will they be recorded? Some of them will be recorded. If you register for the conference online in the portal, it will tell you which ones are recorded and which ones aren't. Yeah, let us know. We would love to be in touch and support you. And get in touch with Nicola and Jen if you'd like to get some cards as well, because they look great, and we're really grateful to you guys for developing them. So thanks everyone so much. Yeah, you're definitely not alone. There's lots of people who are feeling with you, like you. So yeah, that's it for now, and we will see you all soon. Thanks so much, everyone.
Thank you very much.
Bye.
Bye.